Hello and welcome. Welcome to the lunch event on water quality monitoring. My name is Joe Brown. I'm an associate professor here at UNC Chapel Hill, and I'm also affiliated with the Water Institute here at UNC Chapel Hill. And we are convening this session for lunch together with WHO. Rick Johnston is also on the call, and he and I are co-moderating this session. This actually was kind of an unplanned event early on. We got lots and lots of interest around events, side events for water quality. We couldn't accommodate all of them, but we wanted to give everyone some airtime. So we have several lightning presentations that are followed by Q&A. So we are going to be using the chat function on the Pathable site. And so please put your questions there as we go through the presentations. And I will be looking at those and putting questions to the speakers. Yeah, so we hope for a really great discussion. We have some really excellent presentations lined up for you all. So thank you for making time to be here. Next slide, please. So water quality is still a huge issue in the world. And I don't need to tell anybody that if you came to this session. At least 2 billion people lack safely managed water in 2020. You probably all know the current stats from the JMP, and progress is lagging severely in some places, including least developed countries and in fragile contexts where safely managed drinking water remains a distant goal for folks. You may have seen just one reference that I want to throw out there. There was a paper earlier this year in Environmental Health Perspectives. Rick Johnston was one of the authors. Rob Bain was the lead author on this paper that looked at water quality measurements across different kinds of water sources from surveys that included 25 or more data points, both at the point of collection, but also the point of consumption, and stratified by a whole range of infrastructure types that basically shined, I think, what is the most complete light on issues of water quality and outstanding water quality challenges that affect countries all around the world. So this is just one graph from that paper. I highly recommend you going looking that up. But huge percentages of people who live in low and middle income countries are still not having access to safe drinking water where they need it. So we're going to have a few presentations here that are going to examine these questions around water quality and water quality monitoring from a variety of perspectives, including here at home in the United States to begin with, and around the world. So without further ado, I want to pass the mic to Jennifer from RTI International, and she'll have our first presentation. Please, the floor is yours.
Great, thanks so much, Joe. I'm happy to be here today. My name is Jennifer Hoffman, Redmond, and I'm a senior environmental health scientist and program director for our environmental health and water quality programs at RTI International. Today, I'm going to be overviewing our Clean Water for Carolina Kids program, which offers a citizen science approach to lead testing, communication, and mitigation where children learn and play. So there's been longstanding lead use in products over thousands of years. And as most of you know, lead is a heavy metal, and it is also contributing to widespread environmental pollution. However, as lead has been banned in the United States in paint and in gasoline, there still are allowable levels of lead in water piping, plumbing, and solder, with increasing restrictions to reduce the amount, but the potential for there to still be lead in children's drinking water. Next, please. The effect of early childhood lead exposure is irreversible and lifelong, and it causes cognitive and behavioral deficits in children with no safe level of lead exposure, as you can see in this visual. Next, please. So a question that we often get is, where's lead coming from? And unlike some other source water contamination, we don't actually usually see lead in source water or at the water system. It accumulates on the way to your house, your building, your school, your childcare center, and distribution piping and plumbing. Next, please. Our mission is to identify and eliminate lead in drinking and cooking water where children learn and play. And we're going to tell you a bit about how we've done that in North Carolina. Next, please. So in 2017, we did an initial pilot study, and the goals were, one, to characterize lead in drinking water to see, is it even here? Is it a problem? That was a subject of discussion. And two, can we pilot a novel citizen science-led approach that's scalable and allows us to do widespread testing even when we have limited available resources? Next, please. So here's an example. This is our website online, and you can check it out. It's cleanwaterforuskids.org. And we have a portal which lets folks enroll, report, communicate findings, check out publicly available data. And I'm going to tell you a bit more about that. Next, please. So we virtually walk participants through the process of testing for lead with training support, a mail-out test kit, laboratory analysis, and our online portal. And we've really found that empowering staff as citizen scientists allows us to expand our reach and improve the health and lifelong potential of more children. Next. So here's another graphic showing the overview of steps after enrollment. So after enrollment, we train citizen scientists, they complete testing, ship back to our lab, we analyze those results, and we give them back with potential risk mitigation. And we communicate throughout that process. Next. Here's an example of some of the videos that we have online and we showcase in our webinars on how to collect and ship your water samples. Next. And we also provide information on what your results mean and how you can understand your results to take action to get the lead out. And here's an infographic showing that you can practice no-cost clean water habits at any level of exposure. And as there's higher lead levels, we recommend low-cost risk mitigation or to stop your water use and get follow-up help. Next, please. Some of the no-cost clean water habits include designating taps for drinking and cooking with proper signage, and using only cold water for drinking or cooking, even if you're making infant formula, for example. Low-cost risk mitigation includes fixing a clog, flushing water regularly, faucet fixture replacement to stainless steel, installing and maintaining a water filter that's actually certified to remove lead, and installing a water fountain with the same. Next. We have a public mapper on our website, so it helps with transparency. Everybody can see the results and can see the actions taken. Next. Our statewide results in the state of North Carolina, you can see on the right, we have found that about 9% of facilities have at least one tap at or above 15 parts per billion, which is the lead and copper rule treatment-based action level in the United States. But we actually have almost 93% of facilities have at least one tap with detectable lead, and 63% have at least one tap above the American Academy of Pediatrics reference level of 1 part per billion. And we've tested about 4,000 centers over the course of the last 15 months. Next, please. So this program has taken an immense amount of effort, and we want to acknowledge all of the partners that have been involved and the external program awards that have helped us continue operating. We are now expanding to additional family child care homes in North Carolina. We're expanding this work to schools in Georgia, and we're also looking at other contaminants in water using the same approach, including PFAS, also known as forever chemicals. So that's about it. If you have any questions or comments, I know I went through that very quickly. Let me know. I'm happy to answer any.
Thanks very much, Jennifer. That was great. Yeah, Anybody have any questions, please put them in the chat. Not seeing any at the moment, but so maybe I'll ask one. So you've done most of this work during the pandemic, right? And I know there's a lot of people are talking about water being stagnant in buildings and what effect that could have on the accumulation of lead. Any thoughts around that? Do you think your results reflect like that?
That's a great question, Joe. Well, so we actually, have been having two messages. The first message is that it's extremely important to flush your building's water before you come back to using it. And we have been vocal about that and providing instructions for doing so. Also, testing is important. The other thing that we were doing is we were actually asking for centers and schools to not test while they're closed, because we actually want to know what water children are really drinking when they're there. And so we've said, actually, you need to flush your water before you start back. Once you're starting in the process, we typically recommend sampling on a Monday morning, because that's usually the longest time period of stagnation when centers and schools are in session.
Thank you. I hope you'll be willing to put some of the links to the resources that you referenced in the chat on Pathable.
Certainly.
So I think we'll move on to the next presentation now. Again, sorry, these are going to be pretty brief. So I want to invite Magdalen Matthews Kuma to please take the floor. Thank you. Go ahead, Magdalen. You might be muted.
Good morning, good afternoon, good evening, everyone, depending on your time zone. My name is Magdalen Matthews. I'm the Senior Program Officer with the Hilton Foundation. I'm here in partnership with IRC, which is a major partner of ours, but also representing a host of other partners and organizations that we collaborate with as part of our Safe Water Partnership globally, a host of organizations globally based that we work with across countries in sub-Saharan Africa. Today, I'm going to be talking briefly about achieving safely managed water services in Africa, basically in sub-Saharan Africa, and what we have learned over the past couple of years in trying to achieve that objective and what we're looking towards for the future. Next slide, please. So our presentation will cover our journey, where we have come so far as part of our thinking, our strategic thought process, our partnerships, and also how we plan to keep the conversation going over the next couple of years. Next slide. So for the past 30 years, the Conrad and Hilton Foundation and partners have been working to advance safe water in sub-Saharan Africa. And we take absolutely no credit for this, because we're just supporting and working along with partners who are actually the ones on the ground doing the heavy lifting and actually getting the work done. And we've been a shared partner and vision bearer with a host of actors who are on the ground carrying the work through a number of interventions. And we started this work essentially with World Vision back in the 80s. And we've expanded our portfolio over the years, working through a host of partners. And in 2017, we pivoted in response to the Sustainable Development Goals and the realities of where the world was going with respect to the SDG targets, specifically SDG 6.1. And we decided to establish the Safe Water Partnership that was focused on advancing solutions, having a more structured and targeted systems approach in terms of how we were engaging at the district level, and also working towards building a strong evidence base. And what did that look like? We started focusing on innovations. So working with partners such as PATH in supporting them in piloting the chlorinators across different countries. We started working more cohesively with IRC around building governance systems and supporting collaboration through the development of master plans at the district level that brought government and partners around a cohesive single plan that defined what water system planning would look like for the next couple of years up to 2030. And then we started looking more carefully at best practices and what that would look like. And so we also started supporting interventions around collective action approaches. And all of this was centered around sustainability, ensuring quality of services, and galvanizing collective focus and action around SDG 6.1 specifically. Next slide, please. And so we took stock of all of this from 2017 up until 2021. And again, we assessed what was the progress made. And we have defined in terms of our strategy for the next 5 years, looking at where we've come with the SDGs for the past 5 years. And we have refined what the objectives are and what the targets are specifically. And from a management perspective, we realized that we needed to focus a bit more on not just safe water, but also integrating the management component into all of the work that we were doing. And so hence, taking the JMP ladder, our objective moved the needle more from basic to safely managed water services. So for the next couple of years, our focus will be supporting projects with our partners that center around safely managed water services in Ghana, Ethiopia, and Uganda, our 3 target countries in sub-Saharan Africa, to test and prove models and come up with proof of concepts that can demonstrate the possibility of reaching safely managed water services in sub-Saharan Africa. And so we will do so by ensuring residents have access to safe water, having proof of concepts that can be regionally replicated, building a global movement through advocacy, and of course, supporting research and evaluation. And how do we plan to do this? Water quality is going to be at the core element and core focus of what we will drive around this. As the JMP has defined, and I'm really happy that Rick is co-convening this session, what the safely managed services have to do with accessibility, reliability, and of course, water that is free of contamination. What have we learned since we've been going through this process? Next slide, please. We convened a stakeholder session earlier this year around World Water Day that brought together multiple stakeholders at senior levels across the water spectrum. And one of the key things that came out of that is that even though water and sanitation is a human right, it is going to take progressive realization across the different countries. The contexts are very different. And so realizing this right across the different contexts will take different approaches, whether in the urban setting, the rural setting, whether at the institutional level or at the household level, whether at the district level or at the national level. So it will require a different approach depending on the context. So the context becomes very important. Another key point that came out was realizing that underserved populations are very essential, and having a demographic and geographic lens when trying to serve people in terms of safely managed water service is also critical. Water quality and climate resilient technology is key and must be factored in from the very beginning. Another major barrier that we went away with from that stakeholder conversation was that with all of our technological advancements, our best intentions, political barriers also exist and must be factored in as part of the need to reach to safely manage water services. So these were some of the key realizations that came out of that conversation, and factoring in water quality from the beginning as part of the essential element, ensuring accessibility, reliability plus water quality will be essential when discussing how we get to safely manage water services. What have been some of the results we've seen so far? Next slide, please. In Asutifi North, how do we work as partners so far? We've been doing a lot of collective action approaches, partnerships, coming together as different partners across different countries, ensuring innovative models. And we've also realized that where safely managed is not logistically feasible, because we have seen in some contexts that there may be some geographical hindrances and obstacles as to why we may not be able to fully deliver safely managed water services. There is the option of ensuring water services at the point of use. Ensuring healthcare facilities are also covered, as well as schools in Uganda, Ethiopia, and Ghana will also be a principal part of our approach. Next slide, please.
So Magdalen, I'm sorry, but we're gonna have to cut you off there because we're very tightly scheduled. I'm sorry. Please, speakers, keep to your time, but also Magdalen and questions for Magdalen, please add that to the chat, and we'll have to go on. Hopefully, we're trying to squeeze out a little bit more time at the very end for general questions that can be put to speakers as well. I'm very sorry. Our next speaker is Samuel Diarra, who is speaking in the place of, I think, his colleague Brahma. The floor is yours, Samuel.
Yeah, thank you very much. My name is Samuel Tierra. I'm the technical director for water, sanitation, and hygiene. I'm also in charge of quality and innovation at World Vision. We worked very closely with Dr. Prema Apampire as a consultant to support us to review the water quality systems and the procurement guideline we were developing for improving the quality of water. Next slide. The outline here will be to introduce the whole concept of procurement guideline and where we are coming from through the monitoring and evaluation, and then the WASH procurement consultancy, and then to conclude and recommend. Next slide. World Vision has invested more than $100 million in serving more than 4 million people every year in providing safe water around the world. And because we believe that every child deserves clean water, we have conducted a lot of studies, including our own data assessment about water quality, but also engaging University in North Carolina in the process of doing some additional study to monitor and evaluate the water quality. Those studies, they show some contamination of toxic and trace metal in water due to first quality of drilling input and also from the corrosion of water systems. Then knowing that these issues are happening, it was critical for us to look at how we can address those issues. Next slide. So from the review of our database, we came across the 3,457 borehole data we collected with the support of DRI and also the Regional Water Quality Lab in Tamale to check the occurrence of lead in our household water provided through World Vision WASH program. We end up by getting these results, 3% above WHO limit in Ghana, 11 in Mali, 10 in Niger. And then we observe how this contamination is changing over time. And at the end of 1 year, we observe 100% depletion, which is the indication that it is a temporal contamination, mainly by drilling inputs. Next slide. And the explanation I gave right now was in a newly drilling borehole with no pump installed. When we did the 14-country UNC evaluation, UNC went far to check the quality of water in an already installed systems across 3 countries in Africa. The result was that the corrosion was the main cause of lead occurrence through brass corrosion. Next slide. Because of that, and knowing that among all the root causes, except the presence in source of water through human activity and naturally occurring, all the other causes like drilling input, corrosion of materials or corrosion of pump and spare parts are more associated to supply chain and procurement system. We decided to address this through a procurement guideline. Next slide. So we were inspired by the products and standards of the water system used in the water supply system from the source to the end user. And some certification bodies, among others, are shown here as example of what we are following through our guideline system. Next slide. So we worked with partners actually and suppliers to ensure that all the procuring material, being plumbing material, additives, polymers, they are all in alignment with the certification bodies. And once we get them, we need to see a certification mark on them or a copy of certification document showing that the good or the material are certified. And all known corrosive material like brass, galvanized iron should be avoided in our programming. For the gravel specification and also drilling additive, we want to ensure that this is done. For the gravel specifically, we want ISO 14688 sizing to be adopted. And that should be silica or limestone based material, because we know that through riverbed gravel, absorption and desorption can bring heavy metal into the water. Next slide. So from this perspective, we came out saying, okay, we are working with suppliers as well. So it should not be internal only to World Vision, but let's involve suppliers in the process to make them know that we are applying those high level standards, and they should also be in compliance with that. When we are ordering, we put specification, and when they deliver, we check for those specifications and ensure that the quality assurance is done, the certification is done, and all our procurement system should be paying attention to that from the ordering till the delivery. And we want to ensure also that the proper documentation is available at the field level to ensure that any partner and ourselves can audit this system at any time. And all these are preventive ways, not excluding mitigation ways, which we are working on. This is an ongoing study. It is still going on, and we are trying to ensure that when this is effective, we can also influence the whole wash sector with this guideline and procedure change. Next slide. Thank you very much. If you have any question,
Thanks very much indeed, Samuel. I think we'll have to move on to the next presentation, but please put questions for Samuel in the chat on the Pathable site. Thanks very much. Now, Garvita, the floor is yours.
I'm not hearing anything. I don't know if Garvita, you might be on mute.
Garvita, are you there?
Perhaps we should skip ahead to the next presentation and come back to Garvita after that one.
Okay, yep, sounds good to me. Let's skip ahead, please, to Poonam. And Poonam, if you're ready, please take the floor and we'll come back to Garvita. Thank you.
Okay. I think, okay, so now I'll take it. Thank you very much, Joe. And thanks a lot. And I'm very happy to be on this panel at the UNC and Water Health Conference 2021. I am Poonam Seva, Vice President's Program and Partnership from Safe Water Network. Safe Water Network is a New York-based NGO working in India and Ghana. And we have a very important story to tell because just now we heard all my preceding three participants spoke about the water quality and how water quality is impacting the life of communities and public health, and action needs to be taken right now. Safe Water Network will be talking to you, telling you about our 12 years of work in India, where we have set up decentralized safe drinking water solutions called as Safe Water Enterprises. My colleague Garvita would be presenting the various models which we have perfected over the last 12 years, how we brought in the operational sustainability and the financial sustainability, because normally what we see across the world is that most of them are defunct. So I will carry on from there, the story from where we initially perfected the art that we are able to give reliable services of safe drinking water that are sustainable at the local operating level, which means the local revenues of operations can come from the revenues of the water sales. In India, like many other countries in the world, women are grossly underrepresented, making only 26% of the workforce, contributing to just 17% of the GDP, as compared to the world average of 37% by other women. So while others were busy designing methods to reduce the women's drudgery of carrying the water to their homes, we at Safe Water Network, after perfecting the model for operational and technical survival and sustenance, wanted to put money in the hands of the women. We wanted them to be the owners of their safe water sources, so that they have money in their hands. This is how the journey of women entrepreneurship in safe water enterprises began. Next slide, please. The first challenge, as we all know in all the programs, is breaking the systemic barriers. Before breaking the systemic barriers, we need to identify what were the barriers to the participation of women in the water program. They were since time immemorial carrying water, and they were very happy to carry water on their heads. They were working in agriculture, arts, artisan, and poultry, but they were unwilling to take the job of operating a water purification plant because of multiple barriers. The first thing which we did was identify and develop a framework to understand what are the barriers these women face. How can we enable them? We bucketed them into 4 sectors: social, political, educational, and institutional. Social barriers are known to all, and basically they are patriarchal barriers. And secondly, women being confined to unpaid domestic roles. In India, women are by law participating in the water programs and are supported, where 40% of our women at the grassroots level are supported by the government to own and manage their own safe water source. But what did we see there at that level? That there was an exclusion in decision making and the leadership position by segregation of the women or by their husbands taking over their post, which they were allotted to. An important barrier was educational. Most of them were semi-literate, and difficulty in managing accounts, learning, and the institutional barrier, of course, was the lack of access to capitals. Understanding all these barriers, now, in next slide, please, we wanted to understand what is the value proposition that we should bring to excite these women so that they participate and create an opportunity for themselves to earn money and begin a role of leadership which transforms not only economically but also socially, giving them decision-making power. So we defined a 3-step program. We did the QUIT model in the pre-program phase. QUIT model was a model where the community mobilizers and people from their own community in whom they had confidence were mobilized to question their attitudes, undo their fears, involve them, build trust. Next phase began the designing of the program, development of the architecture right from the beginning so that they have the feeling of ownership, they can raise their fears and they participate. That was, and if they develop the ownership at this stage, then retention in the program, which is the 3rd phase, was easy. Now the retention in the program called for development of an ecosystem. Previously, from our experience, we had experienced when the men were working in the water ATMs or decentralized safe water enterprises, they were able to handle multiple tasks and jobs. However, that was not so true with women. So moving on next slide, please. We had to do the redesigning of the model. And in the redesigning of the model, the biggest thing which came to our help was technology, because we introduced water ATMs, remote monitoring system, cashless digital card or smart payment. We introduced training modules in the local language, which were e-modules and automated. Besides doing this technical advancement, we also had to deploy a field service entity because the women were reluctant to clean those 5,000 liter water tanks, so on and so forth. So we redesigned the model with the women to accommodate them, and that increased the cost of the model as we worked further. Next slide, please. But what was the impact? The impact was very good. We were able to bring in women into the program, and women, especially from the self-help group women, which were there in 3 or 4 numbers in one group, were the best to perform because they got confidence from each other and thus were able to earn livelihood. They were empowered financially, and at the same time, they were able to improve the public health and well-being. Next slide, please. So this program, Water Aunties, it is called Water Aunties because this connotation and the name came to them naturally because the people in the local community started calling these women Water Aunties. So now they are called as Water Aunties almost across all water ATMs where the footprint is. In the Water Aunties program 1, we worked with the government of Telangana in one state and developed 93 women entrepreneurs. The journey continued smoothly, and in 2020, we organically grew to have about 170 women in the value chain. However, under the USAID supported program, Sustainable Enterprises for Water and Health, we conducted this Water Aunties program 2, where with the help of our alliance partners, we could scale the program to 20 states. And today, we have 548 women operators of water ATMs across 11 states of India. Next slide, please. What was the scaling up methodology? The first thing was mobilization of the Safe Water Enterprise Alliance partner. In the alliance, we have about 14 partners, of which 6 were very active and participated. We built public-private partnerships with the municipalities, with the local government at the villages, developed skilling and training programs, which are basically web-enabled, e-module, and created an army of master trainers. While we were doing that, it was very important for us to continue to handhold by providing technical and institutional support. Next slide, please.
Ms. Poonam, I'm sorry, but we need to conclude at this point and pass over to your colleague Garvita.
This is the last slide, and
sorry.
I would request all the participants to check out the digital tools that we used for scale up. They are available on the Safe Water Enterprise Alliance site. Thank you very much.
Thank you so much. And I'm sorry we don't have time for questions, but please put that link in the chat on the Pathable side. I think that would be really interesting. And what an impressive program. Garvita, the floor is yours, and I'll ask Anjul, please, to back up the slides to your presentation. Go ahead.
Thank you, Professor Brown. Good morning, good afternoon, and very good evening to everyone joining us today. I am Garvita Chawla. I head the finance for Safe Water Network in India. My colleague Poonam already spoke about how we integrated women into the Safe Water Enterprises program, empowering them and enabling them to lead these enterprises and become financially and operationally independent in doing so. I'll deep dive into what will make these decentralized enterprises financially sustainable. Next slide, please. A lot of the panelists have spoken about water quality and also making these water treatment systems to make sure that safe and reliable water flows to the communities which do not have access to it. Let's first understand what are safe water enterprises. These are decentralized water systems that provide affordable, safe, and reliable drinking water. Safe Water Network piloted the program about a decade back and today provides such water across India and Ghana to about 2 million people. The model works in a way where the donor funds the initial capex, which is a small nominal amount of $1 per person per year. When we look at the benefits of the program and how it flows, a master franchisor like Safe Water Network works with the local government to get all the permissions, does the site selection, capacity building, monitoring and evaluation, and builds a field service entity which ensures that the program is up and running and it does not go by the fit and forget way. The consumers pay amount of about 7 cents per 20 liters. These enterprises have proven to be COVID-19 resilient as they are powered with technology. They are IoT enabled with remote monitoring systems, which have touchless dispensing and also have a contactless system for digital payments. Next slide, please. Why Safe Water Enterprises? I think a lot of, again, panelists have already spoken about the need for safe drinking water. It's an established fact, and India is no different, with about 600 million people who suffer from water stress every day. We need more than 50,000 such water ATMs or SWEs to solve the problem at the community level, which is a humongous investment of about $1 billion to reach 100 million people. Next slide, please. Going further to why these enterprises are the solution or a mode of choice for providing such access. They are financially sustainable at the local level. That is, the revenues that are generated from the sale of the water to the community at an affordable price is able to cover all the local level expenses. They have a 98% uptime. They are 100% quality compliant with the national rules and regulations on water quality. They're environment friendly as they lower the plastic straws that is created with the packaged drinking water bottles that we tend to buy. Recently, and under the USAID program, which is a collaboration between USAID India and Safe Water Network, SEVA, Sustainable Enterprises for Water and Health, we've reimagined these water ATMs as water knowledge resource centers. They act as lighthouses in the city, spreading information, not just about COVID-19. They give information about nearest health centers. They integrate with government programs like Catch the Rain for rainwater harvesting and provide the much needed information to the transient consumer, in addition to creating the social impact of giving health benefits related with safe drinking water. Next slide, please. Now that we've talked about the need and the logic for implementing these enterprises, let's see how financially sustainable they are. Like all the systems implemented across the world, most of them fail to recover all the total costs that are incurred in providing the safe water. We also know that more than 30% of the water systems fail due to lack of service. This is exactly the need that we try to solve by creating a field services entity. Our decade-long experience in the two countries states that within India, we've seen that in addition to initial capex, these enterprises need about $84 per month as viability gap funding to ensure that there is 100% water quality testing, there is monitoring and evaluation, there is a field service entity and a ready supply chain of spares to ensure that the maintenance and repair flows to the enterprises. Next slide, please. As we bring forth these learnings from the 43 members of the Small Water Enterprise Alliance, which has been implemented by Safe Water Network in India and leads it with about 13 SWE operators, we bring together their learnings of implementing 5,000 such SWEs, establishing the need for giving out these subsidies or viability gap funding to ensure that precious investment which has been made does not go to waste. We also bring in our learnings from being technical assistance providers to one of the largest states in the country, which implemented 18,000 such small water enterprises, and where the failure rates were as high as 40 to 60%. Next slide, please. What we asked as the proposed main 5 interventions for mainstreaming these enterprises is that one, acknowledgement of the fact that water cannot be priced fully. And whether it be the biggest municipal corporations of the biggest cities in the world or small enterprises which provide safe drinking water, there is a need for long-term subsidy. There is also a need for results framework-based subsidies, which can actually fund the viability gap. Further, to incentivize the private sector participation to improve efficiencies, promote digital innovations, and also develop SWE benchmarks, which can put the entire sector at the same stage and set the right performance indicators for measurement and taking the whole sector forward. That's it from my end. I'll be happy to take any questions that we have. Thank you.
Thanks very much indeed, Garvita. Any questions? Please put them in the chat. Okay, not seeing any. Please, if you think about them in a few minutes, please add them. And Garvita, thank you very much. I want to ask now whether our final speaker is in the house. If you have signed in, Sut, the floor is yours. Otherwise, we can open it up to Q&A from others. I'm afraid Sut had some problems joining the session.
Yeah, I don't think he joined the session.
Okay. All right. Well, questions for anybody then? I guess now the floor is completely open. If you want to put those in the chat, I can read them out. Rachel from Acquia asks, can you speak about water quality monitoring of your systems? Excellent point. Garvita.
Yeah, so we do a testing of raw water, treated water, and reject water, which conforms to the national water quality standards. There are 26 parameters that are tested for all the 3 tests that are done. These tests are done twice. That is, one is done pre-monsoon and then the other is done post-monsoon. It measures the water quality across all the parameters as listed by the national water quality authorities. Also, the local operators, as Poonam briefed, and including women, are trained on doing daily testing of water. So they have TDS, handheld TDS meters. They do the AOT testing, the appearance, odor, and taste checking for water on a daily basis. They also maintain 7-day water samples, so that in the event of any mishap, there are water quality samples, water samples that are maintained for testing of the water going forward. So there is a comprehensive water quality program that is used. There are further resources that we have on water quality as well for these decentralized safe water enterprises. And I think we could put those files as well on Pathable, Professor Brown.
Excellent. Thanks very much. I see Rick Johnston has a question. Magdalen, you noted the biggest barriers were political, not technical or financial. Can you expand on that a bit and explain how you've tried to overcome political barriers? Magdalen, please.
Okay. If it's okay, I don't know if it's okay, I would want us to just probably put up my very last slide. I was actually going to speak to some of the future looking plans that we have as part of what are just generic plans that we have in terms of work that we're doing with our partners. I think that would sort of set the stage in terms of responding to Rick's question. So no, the previous, just the one before, yeah, where we're going. So in terms of, yes, so I was just going to conclude with this just before I ran out of time. So to respond to Rick's question, I'll just summarize with all of, just put everything together in terms of this specific slide. So in terms of how we plan to address some of the political challenges that we know will arise as part of the work that we're doing. We will be doing continued system strengthening work. So a lot of continued system strengthening work with our partners in the 3 different countries, Ethiopia, Ghana, and Uganda. So there will be a lot of governance components and system strengthening as part of the grant-making portfolio that we have over the next 5 years. One of the key things that we're really excited about is a water quality fellowship program that we're cooking up across the 3 countries to help us generate data and evidence at the district level, but doing this in partnership with academia. So of course, building partnerships at the academic level. So again, ensuring long-term sustainability in the country. We also will be working with the Community Water and Sanitation Agency in Ghana, which is another avenue for us to deal with some of the political challenges. We have on the call right now, Safe Water Network India, but we also partner with Safe Water Network in Ghana, which is a major partner of ours, along with Water4, which are I would say non-state water providers in Ghana, but which have been having some challenges within the regulatory space. So these are some of the political challenges in terms of supporting partners to provide safely managed water. But then there are barriers and red tape around how do we encourage non-state actors, for example, within this space when you have some of the political issues that are not fully resolved. From our perspective as a funder, we want to support our partners by engaging the advocacy space and also engaging the government in a more strategic way through advocacy. So we're working with CWSA strategically to create a conducive enabling environment that allows both non-state and state actors to function collaboratively and complementing each other in reaching the safely managed objective. So we realize that there's a big gap to get to universal access for all by 2030 and to get to safely manage. As you know from the report that you all just put out, you have mentioned that we have to quadruple our efforts. In order to do that, there has to be a collective action approach for all of us working together cohesively. And so bringing all the stakeholders together is one of the things that we're planning to do. And beyond that, in Uganda, for example, we're also expanding some of our work to an extra district, which we were not previously working in. So these are some of the plans that we have underway that will help us address some of the political issues, engaging a bit more strategically with government, working with our partners, seeing the gaps that are in the sector and how those can complement what government is doing in a strategic way, and making sure that what is being funded is complementing, not necessarily competing, but complementing what public sector investments are currently being directed at. I just hope this was able to answer your question, Nick. And I'm happy for us to have some additional discussions on the fellowship program, because it's going to be collecting that district level data that we think will be strategic in feeding into the national level data that you all collect at the JMP level. Thank you.
Thanks very much. I had well, this kind of touches on a couple of questions that we've received in the chat, but just maybe a general question. Any of the speakers, please jump in if you have something to say about this. I know that in some of the places where I've worked, whether more data is a good thing or not depends on your perspective. I know that people and communities can very much benefit from having better water quality data. I also know that that data can be challenging for regulators and for people who have responsibilities in providing safe water to people. So, you know, it's very political, I guess, is what I'm saying, and it sort of matters where you sit as to how much more data you really want. Does anybody have anything to say about that? And just from the context where you're working, seems to be a tension that applies in many places.
Well, if I may provide part of this answer, actually World Vision starts gathering data on our intervention in Ghana, Mali, Niger, and we are continuing to do that for 25 countries in Africa. We are expanding that to Asia and also to Latino America. Those data are very useful. First, they are like an initial input in terms of water quality data in developing countries. The second is that when we are operating in the same zone and knowing that we have some quality challenges, we are able to check the layers having those water quality issues and plan in our water supply systems to avoid it or to mitigate those water quality challenges happening. The third element I want to really mention here is that for planning purposes, for implementation purposes, even decision makers and policy makers, they need data, evidence to build upon that. So data are very critical in our water supply system, but mostly ensuring water quality and taking measures to protect the life and the health of people. Thank you.
Great point. I obviously think more data is always good. Thanks very much to all of our speakers. We really appreciate you taking the time, and thanks very much to all the attendees. We really appreciate you being here. Before I hand it over to Rick for a final word, I just wanted to say, I neglected to mention to express thanks to our sponsor for this session, P&G, Children's Safe Drinking Water Program. Thank you very much. Rick.
Thanks. Thanks, Joe. And of course, we need more data. We need more data. I love data, but really, you can't plan without data. And even when the data show a poor situation, such as in that paper that Rob Bain led on that you shouted out to, thank you very much, at the beginning of the session, that information, you know, it's a surprise, it's bad news, but we have to face those hard facts in order to take actions. And we've seen some nice examples from our presenters about different types of actions that have been taken to improve water quality and to help accelerate progress towards meeting the SDGs. I'd love to give like the top points I got from all of those, but we need to wrap up. I do just want to come to this question though about metals and particularly lead. We had two very nice presentations on lead in drinking water. The nice example from Jennifer of citizen science, focusing on a particularly vulnerable population of children in daycare centers. And then from Samuel, the experience of World Vision identifying lead in several sub-Saharan African countries. I just want to let people know that WHO is producing a lead fact sheet, which will provide practical guidance on the health impacts, but also what actions can be taken when lead exceedances are found in drinking water. That could include further testing or considerations for sampling, identifying the source of the lead, putting in place control measures, et cetera. We expect to publish that probably in the first quarter of next year. So great to see the work that's already being done by World Vision and by Jennifer in the States. So I think more attention on lead in particular in the future for sure. And with that, I think we're bang on time. So with a final thanks to Procter & Gamble's Children's Safe Drinking Water Program. Thanks to all of our presenters, and thanks to the people who contributed chats in the Pathable platform or Zoom. Those chats will stay there so you can continue to add your comments or to respond to any of the questions that were raised. So with that, thanks very much and enjoy the rest of the program.
Thanks, everybody.
Thanks, bye-bye.
And thanks, Rick.